Self-advocacy is crucial for recovery from an eating disorder and any behavioral health issue. It's also a very helpful skill right now during this COVID-19 pandemic. My name is Jessica Scalzo with Compassionate Peer Counseling, a peer counseling service for anyone braving the woods of recovery from an eating disorder and related issues such as anxiety, rigidity. If you also are an athlete, I was a Division I collegiate athlete and very competitive. So if you are having struggles with pressure or ultra competitive environment, that is also something that we work on at Compassionate Peer Counseling. What is self-advocacy? To advocate is to speak on behalf of a person or an issue. So self-advocacy is speaking on behalf of my wants and my needs. This can also include speaking on behalf of a particular issue or a particular systemic change I want to see, because these things also affect me as an individual. Self-advocacy is crucial to our recovery because it empowers us and helps us with self-determination. When we are empowered to ask for what we need, and we have practice with this, and we have experience with getting our needs met, we rely less and less on disordered eating behaviors that don't serve us, that end up really causing harm in the end. Self-advocacy ends up creating more empowerment. And so that's why it can be a very helpful tool for recovery. When I'm able to ask for what I need, when I know that I have the ability to do it and I have practiced it, this creates a sense of calm. And I'll say for myself that having an eating disorder was my way of calming myself when I didn't know another way. And so now having other tools such as self-advocacy really helps my recovery. When I first learned that as a peer counselor, I needed to practice and model self-advocacy, I got a surge of anxiety. I was terrified. Self-advocacy was not my strength. I practiced it a little bit, but I really avoided it. I was a people pleaser. I still have that a little bit, and I wanted to avoid any kind of confrontations or upsetting anybody. I didn't want to speak up for what I needed and upset people and have to deal with the discomfort that may cause in myself. So it was something that I desperately avoided. I would speak on behalf of issues and maybe other people, but for myself, When I say that peer counseling is mutual, like I've said in prior videos, it is true. I am continually working on my skills and learning more and more about it. And as I'm modeling it and supporting it with the people that I'm peer counseling, I'm also working on it for myself. The great thing about self-advocacy, as with most skills, is that it can be developed. It's not something that we're just born with. Maybe somebody is, but that's rare. It's something that we continually work on, we continually develop, and we continually practice. Everyone is really just in this process of learning more, practicing more, and developing more. Well, how does self-advocacy relate to COVID-19? Disclaimer, I want to say this up front. My personal beliefs are that we exist in a system that doesn't really care for people. It favors a few at the cost of the many. And even the few I have to question, are they behaviorally and mentally healthy? I don't know that. So in my opinion, we're in a system that really doesn't care for people. And we can advocate on behalf of systemic change. I encourage anybody to do that. And right now, we live in this system. We gotta start where we are. Learning self-advocacy skills can really help us to take care of ourselves, even in a system that might not be so caring. specifically with COVID-19, there's a lot of needs that are needing to be met. Right now, you might have to apply for unemployment. You might have to apply for a loan or a grant. Maybe you still have to go into work and you're very concerned about your safety. Or maybe you need to take time off because you're very concerned about your safety. Maybe you need to get a COVID-19 test. Maybe you have other health issues that you're very concerned about. Or maybe you're struggling with the stress and the fear around the pandemic and you want to talk to a peer counselor. All of these things take self-advocacy to make them happen. Self-advocacy can help us during this pandemic, and it doesn't stop there. It's going to help us beyond the pandemic. So it's worthwhile to start practicing right now. Okay, how do we self-advocate? Well, this is the topic for the next video, so I hope you'll stay tuned for that. I will start by saying that with self-advocacy, we start with our strengths. What are skills that we already have? What are ways of communicating that we already do, that we're already practiced at? We start with that. We can already feel confident that we know how to do a little bit of it, and it will get us to take a couple steps of trying self-advocacy. If this is something that you want to work on or you want support with, please reach out to Compassionate Peer Counseling because this is one of the skills that we work on. If you want information, the website is www.compassionatepeercounseling.com. I would be thrilled to work with you and support you on your self-advocacy and recovery journey. It will greatly impact your recovery. Thank you for your attention today, and please take care. Talk soon.